Good evening, welcome everybody. This is the first in our new series for this winter. This is Ask the Experts. And what we'd like to do during this series of webinars is to get people in and have a discussion with them on subjects that are going to be very relevant and apt at that time. And we're kicking off this evening with a fantastic pair of experts, actually. So this evening I'm joined by Carolyn Hogan and Ali Anderson, both of which are from Zoetis. They'll both do introductions very briefly. We want this to be as interactive and get the questions that you guys want out there. So if anybody wants to talk to us as we're going through or ask any questions, in the Q&A box, if you're on a laptop, it's down the bottom. If you're on a phone, it's probably up at one of the sides. Please stick any questions that you want to ask anybody in those Q&A, and we'll get those asked for you. This is not going to be an all-evening affair. We're going to try and keep this to 40 minutes. We want to be done just for about 22:07. So we're not going to go on all night. So if you've got any questions, don't hold on till the end. Ask them as we're going through. And hopefully what it means is that we can get everybody's questions answered. Now, for those that you are lucky enough, might still have cows out at the moment, and we're thinking about getting ready for winter housing. Some of us definitely will have already had cattle come in, and so we thought now is an ideal opportunity to find out what we should be doing, what we should be looking at, how can we make this winter as easy and as comfortable as possible, not only for the cattle, but for us, the farmers themselves. So this evening, I'm joined by Carolyn and by Ali, and we're going to go through a lot of the challenges that we all face in and around housing. Carolyn, can I jump over to you first? Would you like to introduce yourself and then kick things off a little bit, please?
I will. Good evening, everybody, and thank you for giving up your evenings, well, 40 minutes of your evening to listen to Ali and I. So just before I start my first slide, I'm Carolyn Hogan. I'm a vet. I've been with Zoetis now. I was in practice for a number of years, and then I joined Zoetis. So I'm National Veterinary Manager, and I cover sort of the beef portfolio, as we call it. I'll just share my screen here because I've got some lovely cattle. I hope you agree. Up on the screen there. There we go. So as Seth said, we're focusing on housing, and as you said, some of you will have your cattle in already. Some, because the weather's been quite mild, may still be ready to house. So hopefully, either way, there's something in here for you. When we talk about managing cattle profitably, I think the three key focus areas are genetics and nutrition and health. And obviously, in the Stabiliser group, you've hopefully got the genetics fairly well covered. We're not covering nutrition this evening. Ali and I are going to be focusing very much on health and health of these animals around housing. And there are other things that come into this, but predominantly we're going to be looking at, or I'm going to be focusing on respiratory disease, and Ali's going to be focusing on parasite control. So why do we worry about respiratory disease? It's essentially the most common disease that we see in animals from 1 to 12 months of age, and it costs the industry a huge amount of money. And I think one of the issues we have is we get these acute losses, but we also get these chronic losses, and those are the ones that really eat into the profitability of any enterprise. I'm not going to talk about antibiotics this evening, but I think we all know the pressure is on to use antibiotics responsibly, reduce our use. And respiratory disease is pretty much one of the areas where a lot of antibiotics go into cattle, or one of the big areas of usage. There's been a lot being done, but that's another good reason to try and control diseases so that we don't rely on antibiotics. So I wanted to just break it down into four. What's it costing? Always good to put a cost on these things, and then we can look at a return on investment from anything that we do. What causes it? What are the risk factors? And then, what can we do to try and prevent it? And when we look at the costs, and this is where it starts to get quite scary, it breaks down really into three. We have the immediate cost, and this was a study, and it's pretty old now, done in 2000, looking at costs in suckler calves, and it looked at the outbreak just for around 3 to 4 weeks, and broke down the costs. And essentially that estimated that pneumonia costs about £70 a calf. And that was the vet medicine costs, any extra labour, and also the immediate impact on weight gain in that first 3 or 4 weeks. So that's just the immediate costs. I think what a lot of us will be familiar with, but maybe harder to put a figure on, are those longer term costs. Because we know, I think we'll all be very familiar with those calves that maybe we treat and then they go down again and we treat them again, and they cost us a lot in the longer term. And I'll just explain this, but not in lots of detail. Essentially, there was a study that was done that looked at calves at slaughter and looked at their lungs and then tied that back to growth rates during their life. And they found that calves that had moderate lung lesions, so moderately damaged lungs, the lungs have 6 lobes, and this was sort of damage in about 3 of them, they were growing at 72 grams a day less than calves with healthy lungs. And those with all 6 lung lobes affected and more severely affected, it was a 202 grams a day less. And so we wrapped all that up and said, okay, we've got an immediate crust of disease. What happens if those animals are growing at 72 grams or 202 grams a day less than they should be? And that's either going to mean that you're going to have to finish them later than you wanted to, or finish them lighter. And you put a cost on that, and it starts to look fairly hefty. They also found those calves with more severe lung damage tended to grade down at slaughter as well, which again, I don't think will be surprising to many of you. And that obviously comes at a cost. And then the third one is this unseen cost. And this is the one that I think is really quite dangerous, because cattle are prey animals. So instinctively, they're trying to hide their signs of disease, because that's a means of, if they're out in the wild, that's a means of self-preservation. And I think that's one of the biggest challenges we have when we're managing respiratory disease, is spotting these cases early enough when we need to treat them early enough. And this was a really lovely study that was done actually in the US, monitoring nearly 500 animals through their lives and then to slaughter. And in that group of nearly 500 animals, 35% got pneumonia and they were treated. But when they got to slaughter, 68% of the calves that had never been treated for pneumonia, never shown signs of pneumonia, had damaged lungs. So these are these animals that are hiding it from you. You're not picking them up as being clinically affected, but their lungs were damaged. And when they looked at that in terms of impact on growth rates, all of those animals with damaged lungs were growing at 76 grams a day less. So that's 20 kilos over that finishing period. And I think if I was going to do this very simply, for every 2 animals that were sick, we had another 2 that were not showing any signs, but their lungs were damaged, and we only had 1 healthy calf. So you can see the impact of this disease is not just those few sick animals, it's having a far broader impact across the group. So what causes it? It's multifactorial, and that's the reason why we don't have a silver bullet. I think it was very simple. It was caused by 1 pathogen. We might get a very good vaccine for that, and that would be it. But there's a lot of risk factors involved in there. It's not just about the pathogens, they're everywhere. It's about all the other factors that go around it. There are management risk factors, all that around stress and weaning and housing, and calf factors, their colostrum intake, certain breeds are more predisposed. And all of that sort of triggers off these outbreaks. Most outbreaks do start with a virus. The bacteria usually come in secondary, not always, but usually. And then we get these cases of pneumonia. And we have to think about lungworm as well, but I'm leaving that to Ali to talk about later. We do some monitoring, and if one thing has come out of this coronavirus outbreak is people's knowledge, I think, has improved in terms of what does antibody testing mean and what does virus testing mean and so on. So this is antibody testing. This is testing calves that have had pneumonia to see what they've been exposed to and what's floating around on the farm. And I've been with the company many years, been running this sampling many years, and this pattern has never really changed. Essentially, I'm showing you 3 years worth of data here. So the 3 bars, there's 5 pathogens, 3 years of data. RSV and PI3, 80% of calves are testing positive year on year on year. So they're everywhere. They're on pretty much most farms. About 30% for IBR, 20%, 25% for BVD, coming down, which is quite interesting if that's to do with the control programs that are put in place. And then Mycoplasma bovis has been hovering in the high 30s. It came down a little bit last year. So these pathogens are everywhere. We're not going to just control them. Just from looking at pathogens, we need to be thinking about all the other things we can do. When we think about types of pneumonia, in that first housing season, it's a typical sort of acute viral type of pneumonia. So as I say, these calves coming in for the first winter, it's usually multifactorial, usually has a virus at the back of it, very often RSV and PI3. can be very acute and very severe. Lots of you will recognise IBR as a syndrome, particularly if you're dealing in older cattle, trading store cattle maybe, or finishing cattle. That's where we see IBR, the very typical IBR. It's an upper respiratory tract disease, and so you see upper respiratory tract signs. But IBR can be part of the pneumonia complex, so it can be in with all the other viruses in younger calves and just show as a pneumonia case. And then bacterial pneumonia. And as I say, mostly the bacteria, they're commensals, they live at the back of the throat, they're just waiting for the opportunity to come in and do some damage. So they come in on top of the viruses, but usually secondary, not always. This is why you give antibiotics. But if you send a chronic pneumonia case in for a post-mortem, one that you've treated a few times, all that they're ever going to find there is the bacterial damage, because the viruses have long gone. The bacteria come in and cause some of that horrible damage that we see in these more chronic cases. And I've just mentioned Mycoplasma bovis because I think it is pretty well known now. It used to be thought as a problem more in the dairy sector, but it's very much established in the suckler herd now. Just it spreads very rapidly, can be quite difficult to get rid of, and doesn't respond to all the antibiotics that are licensed for respiratory disease. So if you're dealing with Mycoplasma, maybe some slightly different strategies for dealing with it. It can just be part of pneumonia, but some of you will see these calves with head tilts or swollen joints. That can be an indicator that Mycoplasma might be around. So why do beef calves get BRD when they're weaned and housed? Well, it's because they meet the viruses. They essentially come inside. So it's not that they're not exposed to viruses when they're outside, but when they come inside, they're exposed to much more concentrated levels of it. And that's to do obviously with the housing and ventilation. So that risk increases if the shed doesn't ventilate properly or they're mixing with older animals. So again, back to coronavirus, it's worse in winter because we're all inside in that environment with sort of recirculating air. And that means we're exposed to higher levels of it, exactly the same in the calves. So when they come in, the exposure is going to increase. And they're stressed. Autumn time is pretty stressful for these calves, these spring-born calves. We wean them, we'll be possibly, if we're selling them, they're going through markets, or if not, they're still being transported, possibly mixed with cattle from other farms. There are management processes, dehorning, castrating, which can be going on, dietary changes, and particularly grain-based diets, which can increase the risk of acidosis. All of that's quite stressful, and stress causes cortisol release, and that's not great for the immune system. These animals are sort of fight and flight preparation, not I'm here to deal with disease. So they're coming in, they're being exposed to the viruses more at a time when they're actually quite stressed. And all of that together obviously increases the risk. AHDB actually do a really lovely book. I'm sure many of you will have seen it, the Better Returns Programme, and don't be misled by the dairy-looking creatures on the front of that book. It's got some really good advice for suckler farming as well, and particularly the page on reducing stress at weaning, which are all good factors to try and, I mean, they have to be weaned. We can't remove that stress altogether, but you can reduce it by managing it properly. Okay, so prevention. And as I say, I'm going to focus a little bit on housing and vaccination, but it goes beyond that. As I've said, it's very much a balance. Those pathogens, as I showed you from our little antibody study, they're absolutely everywhere. You won't get rid of them. So they're on the farm. So what can we do to try and reduce the challenge? So reduce the challenge levels in the shed, reduce all those risk factors that we've talked about, the stress, the management, and so on, so that we've got a calf whose immune system, whether that's its own natural immunity boosted with vaccination, but its immune system is strong enough to be able to fight off anything that's thrown at it, so that we keep the calf healthy. I'm not touching on treatment. All I want to say is, if you are dealing with pneumonia, early effective treatment is absolutely paramount. If you are not detecting cases early enough, however good your antibiotic, you are not going to treat those animals effectively. The most important factor when you're treating a case of pneumonia is that you pick it up early and treat it effectively. Chronic pneumonia is effectively a failed treatment. So just try and remember that. Okay, back to buildings. So 4 key considerations: ventilation, drafts, moisture, and temperature. It all used to be about ventilation, fresh air. Let's get fresh air floating through these sheds. but actually equally as important that we want fresh air, but we want to avoid drafts. Now, obviously in older animals, if you're dealing in store cattle, finished cattle, you know, we don't need to worry so much, but if you've got autumn-born little suckler calves, those drafts can be equally as important as if you're sort of dealing in reared calves. I remember visiting one farm that had a horrible outbreak up in sort of Scotland, big shed on the side of a hill. And it was the pen that had essentially a door on it with great drafts underneath, and the wind came whipping through that pen down the feed alley down the middle, and the pneumonia outbreak broke in that pen of little autumn-born calves. So I know they've got warmth from being near their mums, but you still need to keep them out of drafts. They still need to be able to nest. Okay, so yeah, airspeed, wind chill. If they are younger calves or they're sick, drafts are not good, and it increases their lower critical temperature, and that's the temperature which they start using food to keep warm. So that reduces then productivity because they're putting that food into keeping warm and not into growing. So ventilation, good. We want air movement through the shed above the calf level. We want fresh air coming in and stale air leaving a building, but we want that to happen in a controlled way. We don't want doors left open, gaps under doors so that wind can whistle in and calves get caught in drafts. So good ventilation, but avoiding drafts. Moisture is the second biggest one, is because if we have lots of moisture in a shed, that's very good for the pathogens. They like moisture to survive. And obviously there's a lot of moisture being produced by these animals in feces, in urine, in respiration. And if you have a shed with poor ventilation and say warm air rises, can't leave the shed, condensers come back down, got moisture levels, or if you've got overflowing water feeders or poor drainage and the moisture builds up, the pathogens survive better. That increases pathogen density, that increases the challenge level. So moisture control on every level is important. So a few problems: shed with very, very little inlet for fresh air to come in. Some people will obviously put up spaceboarding or vented sheeting. This vent air sheeting only has a 5% void ratio. So if those little gaps get filled with muck, that can be like having a solid wall. So again, you've virtually got no inlets. And here we're looking at no outlets. So warm air needs to rise and leave a building. And if at the very top of the building, it can't escape, it condenses and comes back down again. So you can very quickly look at your buildings when your cattle are in. Best to do this when the cattle are in, because it's the cattle that drive the ventilation stack effect. Set off a smoke bomb, see where the smoke goes. And if it doesn't effectively clear in less than a minute, then you've got some pockets of sort of not great air movement. So do it on a still day when there's not a wind and the cattle are in, just see what's happening. And you may even find that areas of the shed that ventilate well and areas that don't, and therefore there might be patches that you need to focus on. So some solutions, some nice sheds, we can open up the inlets, open up the outlets in these very broad span sheds. It's not just an outlet down the middle. We might put slats in the roof just to allow air to escape. And it may be that we go into putting artificial ventilation in. So I'm no expert on that. If you're going to do that, obviously, get expert help in to do that. But there are solutions to make sure these sheds work properly. Okay, and what about vaccination? So again, I'm probably speaking to people that as vaccination is an area of interest, because we're all getting vaccinated. Possibly all of this will be a little bit more familiar. Vaccination, not a substitute for good management. Don't know how that translates to people, but the next bit does. Vaccination protects a population, not an individual. So when we're vaccinating, we're trying to do two things. We're trying to increase immunity. So for the individual animal, we're trying to up its whole immunity, its whole resistance. And we're also trying to reduce the challenge by reducing the amount of pathogens those vaccinated animals shed. So a vaccinated animal will be more immune and it will shed less virus. Exactly the same as with the coronavirus vaccine, your immunity will be up. And if you do get infected by somebody else, then you'll shed less of it. Exactly the same here. And that's why it's a herd strategy, because we increase the immunity of the whole group and we vaccinate them all, so we keep the shedding levels down. What vaccination program depends on the age of the calves and some other risk factors. So I've just done a few thoughts, not sort of this is the vaccine program, because it's very much a discussion to have with your vet about what's most appropriate on your farm. But if we're thinking about little autumn-born calves, they're born in the middle of the risk period. They're either born just before or right in the middle of the housing period. So we really want them rapid protection. That's probably our key priority in those little ones. They'll have colostrum antibodies, which might interfere with some vaccines, some injectable vaccines in calves that are under 12 weeks of age. So this is where commonly we use intranasal vaccines that can go in, usually sort of around, week 9 days age, depends on the vaccine. And the key viruses are that RSV and PI3 that we spoke about. So this is the classic thing in these young calves would be that you'd probably choose an intranasal vaccine because you want the vaccine to go in at a young age and to work quickly because they're born into that middle of the risk period. When we think about spring-born calves, and I'm almost glad I can't see you all because of what I'm about to say here, but we want them to have good broad protection through the winter housing period, and particularly for the viruses, because we know the virals are important in that first housing period, maybe some of the bacteria as well, dependent on risk. But ideally, we'd get them fully vaccinated before they come in. And by fully vaccinated, if it's a 2-dose vaccine, both doses, and we've given them time to work. So again, you'll all be familiar with this onset of immunity. It takes a couple of weeks often for vaccines to work. We want them to have had the vaccines and for those vaccines to be fully effective. So if you were using, say, Risval 4, that would mean giving the 2 vaccines and finishing the course 2 weeks before housing. I put intranasal vaccines for speed. For some people, they can't manage that. And so intranasal vaccines are an option. And it would be about weighing up the risk benefits of, I might not get all the things covered that I want, but actually it's going to do it quicker. And maybe that is better for you. So hence, as I say, a conversation with your vet. And when we come to store cattle, IBR is probably one of our big risk factors, and pneumonia risk is very high. IBR is our key risk. We want rapid protection. This is commonly where we see IBR vaccines used on arrival intranasally, and think about quarantining before mixing. Some farmers do vaccinate their calves before they sell them. And so it's always worth considering that, because if we can get them vaccinated before they travel, before that risk, that has to be a better option. I'd love if we could get the whole industry joined up so that we vaccinated cattle before we sold them on to somebody else. But we've been trying that for a few years, and we've got some great farmers doing it. But it's not widely adopted by everyone, which is a little bit of a shame. So some tips, and I'm just looking at my watch here because I'll do this very quickly so we can pass on to Ali. When you are vaccinating, try and get them vaccinated before the risk period. Vaccinate all the calves in the group. Store your vaccines properly. Make sure your fridge is working. A lot of them don't, and then it becomes a cupboard in disguise. Follow the data sheet. Make sure you give the right dose and the right volume, and calibrate your guns. Try not to vaccinate them when they're stressed, because they won't respond as well. Need to think about how you'll manage sick calves. If the calf is really sick, you shouldn't vaccinate it, but I've just told you to vaccinate the whole group. So what do we do about those? That's a conversation with your vet. And remember, they're part of the control, not the whole answer to it. So this is my last slide, and this will be my summary. When you're thinking about controlling respiratory disease, it's not one single thing. It's the animal, it's the pathogens, the infectious agents, and it's the environment. And you need to focus on all 3 to get good control. So that's me.
Yeah, thank you very much, Carolyn. Now, we've had a few questions coming in. Just a reminder, if anybody wants to ask us some questions, then please stick them in the Q&A box down below. Now, we've had a couple of questions that come in that people are exactly where we thought they would be, that they've got cattle coming in the next week. They've not vaccinated their animals yet. Yeah. What do they do if cattle are coming in this next week?
Yeah, I think, back to that thing that I said about the choice of, do you use injectable vaccines or intranasal vaccines, if which is the better choice? I think the better thing is to try and get some immunity in before they come in. And most of those injectable vaccines are 2-dose courses. That's not just ours, that's the other vaccines on the market. So I, at that point, will be looking at intranasal combinations of intranasal vaccines that you could do in ideal single handling. And then they generally work, even if their onset of immunity is say 7 days or a little bit longer. Often, because they've gone intranasally, there's often something happening before then. So I would definitely go down the intranasal route and just again have a chat with your vet about what combination is right for you. Yeah,
and then the other question that has come in is is about the length of time that the intranasal keep the animal covered. How
Yeah.
long does that last?
Yeah, so I mean, we're talking generically about intranasal. So the intranasal RSV and PI3 vaccines, I can say this: there's more than one on the market, but they all last 12 weeks. They all have a duration of immunity of 12 weeks. But IBR vaccines given intranasally are often up to 6 months. The injectable vaccines, it depends. It's not the same for all the vaccines, but I do know for the three sort of RSV PI3 vaccines, it's 12 weeks. So that's fairly simple. And you know, again, in terms of you're saying about managing that, because some of the injectable vaccines are 6 months. If you do those, you get them through winter. If you do an intranasal, it's 12 weeks, and that's the compromise that I'm saying that at this stage, you know, you're going to be managing that and saying, right, I want to do that because that's quick. But what am I going to do? Am I going to revaccinate them halfway through winter, or how am I going to manage that? And that again is a risk assessment on each farm.
Wonderful, great. Now look, that has prompted a whole heap of questions coming in. Now, what we're going to do, we'll hold off. We will get to all of those questions, but before we get to those questions, let me introduce Ali. She's our second speaker this evening. Ali, would you like to do a brief introduction and then jump on?
Yep. Lovely. Right. Yes, thank you. My name's Ali. Like Carolyn, I'm one of the technical vets at Zoetis, and I currently look after our parasitology portfolio on the cattle and sheep side. So what I just wanted to run through really was just a little bit of a brief overview of some of the parasites that we need to be concerned about at this time of year. And one of the great things about housing and housing cattle in particular is that it gives a real opportunity to clear out some of the parasites, and the animals are then obviously staying off pasture for a while. So it means that we can treat effectively if we need to, and really put a stop to those parasite life cycles. And I would just say to start with that it's quite a broad subject. There's a few different parasites I'm going to cover, and it really is quite farm specific. So, you know, it'll depend where you are in the country, depend how wet your farm is, various different factors going on. And I'm just going to sort of really touch the surface of what the different options are and things. So please do, you know, obviously ask any questions you have today, but speak to the people who know your farm and your system and your setup. Because there's plenty of people out there with good information, sort of your vets, any local SQPs and that kind of thing, that people really will be able to give you very farm specific advice on some of these parasites. So what are the ones we're concerned about? So I think you think parasites, I think gutworms is one of the first things we think about. I'm sure you'll be aware of the impact that, if left untreated, that worms can have. Studies have shown up to a sort of 30% reduction in growth rate in some cases. And I think it's the overall effect as well, that reduction in carcass quality and that side of things that comes with it. Now, for some people, it's been quite an extended grazing season. And what that means is there's been that extra chance to pick up more parasites. And I think as we get towards housing, it's thinking, what is the risk? What have I, you know, have I given any treatments over the summer? When did I last treat? What were they treated with? And again, in an ideal scenario, if we're coming up to housing, a really great thing to do would be to do some testing. So do a fecal sample, look for worm eggs, and then we can make a treatment plan based upon that. And one thing just to bear in mind is there's some species of worms that in order to survive over winter, they effectively go into hibernation inside the cattle. So what they'll do is they'll just sit quietly in the gut wall when they're in their developmental stages. Won't be causing any problem. The cattle will look absolutely fine. But when it comes to springtime, those worms will emerge, and we can, if there's a lot of them there, you will get potentially quite severe disease in the springtime. So that's where it's just really important with our treatment choice in the autumn, really good opportunity to clear out those worms. And most wormers, so the group 3 worms in particular, will kill off those hibernating stages. So it's just something to think about with your control options. So lice, again, we seem to have reports of quite a lot of lice about last year. So just something to think about. I think when it comes to lice control, it's just remembering how best to manage it. none of the treatment to really have any sort of persistent activity with lice. So it's really important that we treat everything in the shed on the same day if we are treating for lice. And if we're adding any cattle in through the housing period, then make sure they've been cleared of lice as well, because what we don't want is to treat animals as they come in, solve the problem with lice, then add in animals and you get an issue with lice developing later on in the season. And again, you've got a couple of different options for lice. Some of the sort of spot-on products that would just treat for any lice, ectoparasites, or again, we've got the group 3 selection of products which will not only treat for worms but will also treat for lice as well. So again, a few different options to think about when it comes to treatment choice. Now, lungworm, Carolyn's mentioned, I think I have spent most of the last 2 weeks mainly talking about lungworm. We've had a really bad year for it, and it's been sort of, I mean, I've been sort of involved in cases in North Wales, Northern Ireland, Southwest Scotland, further north in Scotland as well. We're just seeing an awful lot of lungworm, and I think it's because the conditions are just perfect. You know, especially now we're having a warm and relatively wet autumn in different places, and it just means that those lungworm larvae are just having a really good time and causing an awful lot of problems. And I think which fits in with what Carolyn's been saying is, again, if we're coming up towards housing, Carolyn's talked about all the stresses they're going to meet. What we want is to make sure those lungs are in the best condition that they can be before they actually get to housing. So I'll come on to treatment choices in a second, but what we really need to think about is, if you are concerned about lungworm, making sure that we treat maybe before housing so the lungs have a chance to recover. But also, if animals have had lungworm during the summer, they are at more risk of having a respiratory disease issue when they get into housing. So that's where your vaccination is really, really important, helping doing everything we can to stop that. And then finally, another thing to worry about is liver fluke. And again, you'll know your farms, you'll know what your history of fluke is. There are various forecasts now. Let's do a fluke forecast. Haven't seen an official one for this year yet, but going by the weather that we had a very cold and dry spring in a lot of places, and some dry periods through the summer as well. So it's likely to be a relatively low risk area overall picture for fluke, but that doesn't mean that the conditions on your farm mean that everything will be okay. So really do, if you have got fluke issues in the past, make sure you're thinking about how you're going to manage that. So I just wanted to touch on lungworm treatments. So within the group 3 products, they all have some longer lasting activity against lungworm. So with CYDECTIN boron, for example, because of the length of cover you can get, you can treat for up to 5 weeks before housing for worms, and it means that you don't need to worm again before housing. And what that means is we can treat early, get all those lungworm cleared out, let the lungs recover, and then when we hit housing, the lungs will be in a much better condition, and hopefully we won't see the problems that we have when it comes to respiratory disease. It also means they'll cope better with the stresses, and again, just means that those respiratory vaccines hopefully will have a better response. So just think about what products you're using, and as I say, some of them have slightly different length of times they'll work, but any of the group 3 products will give you that few weeks of protection. So just check the length of protection with what you're using if you are thinking of treating before housing. I'm not going to go into fluke in too much detail. I just wanted to touch on it because it's fairly complex. And not only is the parasite fairly complex, the diagnostics are complex as well. So I just wanted to touch on diagnostics because if it's a low risk year, diagnostics is a really good thing to do, because it might be that you don't need to treat at all and you can save yourself a lot of money by not actually giving any fluke treatment. But to do that, you've got to do some testing, and not all the tests will show whether fluke is present. So take the top line, for example, the fluke egg count. Obviously, it's the adult fluke that lay the eggs. If the fluke haven't got to that stage, and it's a pretty long life cycle, can take about 18 weeks for the full life cycle. If there's not adult fluke present, then you wouldn't get a positive egg count, but there could be immature fluke, the younger fluke, causing damage and affecting productivity, but you wouldn't get a positive fluke test. So There are diagnostic options, but it's just really important that you understand what you're looking at and what this then means. And then again, just very briefly, all I would say about the fluke treatment is not all fluke treatments treat all stages of fluke. With worms, they'll, you know, it's fairly basic. They'll kill off the adult worms that are there and the immature stages that are there. With fluke, some of the actives treat for different ages. And I think I just wanted to put this up as a reminder, just to have a think about it. This time of year, if we treat for fluke, it's probably the younger fluke that we want to treat. So using one of these products that are going to treat the earlier stages of fluke is really important. If it comes to springtime, it's likely that it'll be adult fluke that will be the issue, and that's where we can use these products that treat the adulticide. So treat the adult fluke. So again, it's just to really flag tonight that fluke treatment isn't as straightforward as just picking up a product that treats for fluke and thinking that you'll be okay. It's just that extra thing to think about and to discuss again with your, you know, your vet or your animal health advisor. And unfortunately, we have lost one class of fluke treatment as well this year, and that's no longer on the market. So again, we've got less options for treating, which is disappointing because it gives us problems when it comes to trying to stop resistance developing to these different groups. But it is just letting you know what the other options are that are out there as well. And again, just a bit to think about with what you're trying to achieve with your treatment. And then finally, just wanted to mention, and I've been talking about treating at housing, the real benefits we've talked about with the lungworm options, but if we treat at the point of housing, we're clearing out all the kind of nasties that could be causing problems. Again, test where possible. If you have got a confirmed fluke and worm infection, we treat at housing, we we'll move the worms, we'll remove the majority of the fluke, we'll have the lice under control. And then what that means is, as they're switching onto feed, getting used to housing, it's more expensive feed, you haven't got those parasites in there dragging them down. And the only thing to add is, with the fluke, if you'll remember that it doesn't matter what product you use, they won't kill every single fluke. So if we wait a few months, we'll have knocked out the majority of the parasites. We can then either test again about 3 months after housing, just to see if there's any fluke have got through, or again, treat with one of those adult products. They'll kill off the adult fluke. And what that means is, when we turn the animals out in springtime, they're not spreading any fluke eggs, you're not contaminating the pasture, and you're hopefully reducing the fluke challenge that you're going to see for next year. So that was a bit of a whistle-stop tour. And as I say, there's sort of, hopefully just gave you a few things to think about, rather than, yeah, there's a lot more, particularly with fluke, that you can go into, but I'd be here for another 2 hours, and absolutely nobody wants that.
Wonderful. All right. Well, thank you, Ali. That was excellent. Now I'm going to run over a little bit, but I think we've got so many questions that I think it'd be worth it. Anybody wants to get anything asked, get them asked now in the Q&A box, and we'll go from there. Now, Ali, a couple of times you mentioned group 3. What does that mean? Oh, sorry.
Yeah, there's different classes of wormers. So with cattle worming, you've got your group 1s, which are your white drenches products. Group 2, your levamisoles, and then your group 3, which are your macrocyclic lactones, and that's your sort of ivermectin, doramectin, moxidectin. With sheep, there's now group 4 and group 5 wormers as well, the newer actives, but with cattle, we've just got those 3 groups of wormers.
I don't know whether that's made it any clearer, but thank
you.
Sorry.
It's more to do with if you just use one class of wormer repeatedly over the years, you're potentially going to build up resistance. So it's, if you can include, say, you're using group 3s at this time of year, look into, can you fit other wormer groups in earlier in the summer if you're worming. It's working along those lines. But again, I'm sure, you know, any detailed questions, let me know, or speak to your vets, your SVPs, they'll help you out.
No, that's great, and that leads into another question that we've had about the immunity. Is what are the challenge of building up immunity?
Yeah, so it's a good one. So cattle will develop immunity to the worms as they're exposed to them. So for most worm species, if they're out grazing for at least 4 months in that first season, they'll build up natural immunity, so that the following year, if they face those worm species, they'll be fine. They won't be sort of dragged back by those worms that you'd expect. The one to be careful of is Ostatagia, which is the main kind of production limiting worm we see in cattle in this country. That can take a couple of grazing seasons for them to develop full immunity. And that's the worm I was talking about that can hibernate over the winter as well. So that's one that with your second grazing season animals, you just need to keep an eye on them as well, because they may not have that full immunity. When we think about our adult animals, you'd hope that they'd have built up immunity, that when they meet the worm challenge, that they're okay and they don't need treatments. But you've got to think about how long your grazing season is, because you have to keep this kind of trickle exposure so that they can keep that immunity. It's a bit like a natural booster. When we're thinking about vaccination, they've got to meet the challenge in order to keep their immune systems primed to work against it.
Yeah, fantastic. That's great. Thank you. All right, there's been another question come in around coughing. If you're hearing an animal coughing, is it pneumonia or is it lungworm?
Where are they?
Yeah, that's a very good question. Ali, I don't know if you want to take, do you want to take that or shall I take that? You can start.
I'll go first. I think with, if they're coughing at pasture, and it's a sort of a soft cough, I'd be highly suspicious of lungworm. It's not that simple though, because once those lungs are damaged from lungworm, they will very quickly develop secondary bacterial infections. If you see animals coughing, you treat with for lungworm, they may improve a bit, but then they may get more viral issues, bacterial issues. The treatment as well will kill the adult lungworms, but then they've still got to cough them up and get them removed, so they can sometimes look worse after treatment. And so, yeah, I think the key is if you see them coughing, seek advice straight away. Have you got anything to add, Carolyn?
Yeah, no, I think you're right. A little bit the same if, if you haven't wormed cattle when they come in and then you're seeing coughing soon after housing and the cattle have been obviously nibbling the grass and things, then lungworm would have to be in your list of possible differentials. I think Ali spoke about worming, bringing the worming further pre-housing, depending on which product you use. And that can be a really great way, because down to that sort of reducing the risk factors when they come in, if they have got lungworm, you can clear that out a few weeks before they come in. That has to be a good thing, doesn't it, to get that cleared out? Because as Ali said, if you do the worming at housing as well, and they're sort of trying to deal with the lungworm infection and coming in and all of that, just throws a whole load of things. So I think it's the timing, either at grass or soon after housing, depending on what your worming strategy's been, you would have to rule out lungworm.
Yeah. And just for my bed, you can do them both at the same time. You can worm and you can vaccinate at the same time.
I'm going to hand this one to
I'm
Ali.
going to let you take that one.
You can let me take this one. Okay. Well, I'll start, shall I? So it's about what, from our point of view, it's about whether things are specifically licensed to be given together. And as working for a pharmaceutical company, we tend to sort of, we have to be a little bit careful about, are there specific licenses or not? Now, there aren't specific licenses to worm and vaccinate together. But again, if you're speaking to your vet, they may advise you, because then it becomes about a risk benefit on your farm of, maybe we're only handling the animals once 5 weeks pre-housing, and for your system, it's going to work to deliver the vaccine at the same time as worming. And that would be the decision that you would take with your vet for your particular farm. So I know both of us are stressing that, but every farm is a little bit different. And a lot of these things, you'll design the programs around what works for you. So as Ali said, about the worming and immunity and what do you need to do depending on risk. Same for we've used intranasal vaccines. Are we going to do something halfway through the housing season? Well, that comes down a little bit to risk, and that again is a conversation that you'd have for your unit, with your vet, I think. Do you want to add to that, Ali, or?
No, you've covered it well. I think it's and for me, it's what's practical and what, handling facility. There's so much with it. I think we can talk about the ideal scenario, but we're very aware that that's not real life. And I think for me, it's about you've got your absolutely perfect program, but that's no good if it involves handling cattle 15 times, and it's just never going to happen. It's about working with your vet to get a practical plan that you're going to do, because the worst thing is to have a plan that you just look at and go, well, there's no way that's happening. Going
absolutely.
On.
Yeah.
Not helpful.
That's great. Well, right. I think you've both said it a lot this evening, but I think the answer is really have a conversation with your vet and put that plan in place with your vet for your farm on the challenges that you're seeing at the moment, to make sure that you're getting the benefits of whatever vaccination or worming or any other treatments that you need to do at that same time.
And I think plan ahead, because housing is likely to be in a certain period of the year. Don't wake up in the morning and say, I'm going to house this afternoon, what shall I go and buy? Try and do that a little bit before then, if possible.
Yeah, absolutely.
Great. Now, look, we have got a heap of questions we're not going to get to. So if anybody sent questions in and we've not answered them, we will get back to you individually. But there was 2 that came in fairly early. They're both along the same lines. Is there an ideal age to wean suckler calves? And would you wean by age or would you wean by weight?
Ali, are you taking? You're going to go first? Oh my God. You want me to take that? Did you say? Yeah.
Yes, please.
Yeah. So I think, I mean, the reality is, I guess this all comes back to controlling your breeding and your calving, because the tighter that you can have your group together in terms of the breeding and the calving, the better it is when you bring them into weaning in the autumn. Because the reality is, you're likely to be thinking about weaning and either selling or housing at a set time. And from a disease control point of view, if you've got a wide range of ages and weights within that group, that's a risk factor for things like respiratory disease, because you've got different ages, but also those younger ones in the group are going to be more susceptible as well. So I in terms of I know that's a question. I'm probably not dodging the question, but I think it is about having a breeding program, and that's all the fertility end, which is outside the scope of this, but trying to have as many of them calving down that first 3 weeks, so that we have a tight calving, a tight weaning, and a homogenous group that come in the autumn. I think that's the most important part.
Yeah, and look, from my end, I would definitely say that that ruminant animal is capable of being weaned, and we see it on the dairy herd at 12 weeks old. So you've got to make that decision based on your farm, what you've got, how much feed you've got, what your housing situation is like. All of those things have to be put into place. There's not one answer for everybody, but again, have a conversation with somebody else and see if you can put a plan in place. Right, well that's it. Time flies when you're having fun. I wanted to do 40 minutes. We've done 50, but I think it's been very, very well worth it. I'd like to thank you, Ali. I'd like to thank you, Carolyn, for your time and your input this evening. I found it fantastically useful, and I'm sure everybody else has. Thank you all for joining us this evening. If you want to find out more information from Zoetis, where do we find that?
So there's a website, which is, we can send that to you actually, Seth, if you want to post that, that you can do that. And also a customer, we'll give you the general customer support number, because that's probably the easiest way, because there's always someone at the end of that phone, and then they can always put you through to one of us as we've got a team of field vets as well, so we can direct those calls there if you need to speak to somebody in a little bit more detail. So I'll send those details, you can post those.
That would be great. That's wonderful. So if anybody's got any questions and they want to delve into any of the topics we've discussed anymore, they can head over there. If you want any more information on stabilizers, then head over to our website, which is stabiliser.co.uk. And again, pick up the phone. We're only at the end of the phone. We're more than happy to discuss anything with you. But thank you all for your attention. Thanks for coming in this evening. Have a wonderful evening, and we'll catch up with you very soon. Thank you.
Thanks, Seth.
Thanks, everyone.